Namaste, I'm Dr. Sanjeev from Vedic Treat. Today, we will learn a few things about diabetes. How do we get diabetes? What can we do? Types, all these things. Diabetes is usually measured by the sugar level in the body or the blood. Now, there are most, the whole world, there are many people, they are affected by diabetes. Diabetes is a metabolic disorder, and it's again considered as a lifestyle disorder too. So when we talk about lifestyle disorder, means it happens because of our lifestyle, a stressful or fast lifestyle, or the food habits what we are actually having every day. Uh, so when we talk about lifestyle disorder, the best thing is we have to look into lifestyle or food habit, daily what we are consuming or how we are keeping ourselves fit and healthy. Diabetes, majorly there are two types, type 1 and type 2. Apart from that, there is a gestational diabetes as well as congenital diabetes also. There is some condition called as pre-diabetic stage also, where your sugar levels are almost little above the normal or to the uh, higher level. That's called as pre-diabetic stage, where you have a chance to come back or regularize by altering your lifestyle as well as food habit. As I told you, it's a metabolic disorder. It's how the body digests whatever we eat. Depending on that, our sugar level keeps on varying. When pancreas completely stops producing insulin, it's called as type 1 diabetes, where the person has to be dependent on insulin. The second category is it may stop or partially or reduce quantity of insulin secreted in the body, or else body cells unable to actually get the benefit of this insulin. But also sugar level goes very high. So either of the cases, you need to look into your lifestyle. As I'm emphasizing on lifestyle. If the person is continuously under the stressful situation or overworks, or there is no physical activeness in the work, or there is no physical exercise every day, and consuming more oily food, carbohydrates, rich food, sugar, sweets, and very high calorie food, when consuming that, we're not doing any exercises or any body movement, we're not keeping our body active, that means we tend to get to diabetes. In the stressful situation, will have a high risk of diabetes. So once the diabetes comes, usually the patient is diagnosed with the diabetes, he usually have a higher sugar level in the blood. The glucose level will be a little higher, or depending on his lifestyle as well as the food what he consumes. There will be some symptoms like the person who is in diabetes, he go for frequent urination, fatigue, weakness, his body will not be active. Sometimes he may feel very tired. The mouth gets dry, he feels like drinking more water, and frequently even he may feel hungry also, because the cells are not actually getting the food. The consciousness usually wants more food. And he'll become lazy also. Then the person has to go and consult a doctor, get checked his diabetic the sugar level, and start taking either medicine or take care of his lifestyle as well as the food. There are many complications also. If the person has not taken care properly during this diabetic stage, or he's not taking the proper medicine and lifestyle changes, then the tendencies of having a stroke or cardiac issues or other organ failures, kidney issues, vascular, diseases may encounter. This is diabetes, even though it's in, we feel that only little higher stage. It's very, very important to the person to take care of his lifestyle, take charge of the whole thing, disease, consult a doctor, regularly visit doctor, or regularly to keep an eye on the sugar level, have a healthy lifestyle, have a healthy food habit, less consumption of high-calorie food, avoiding curd, the refined or white rice, refined wheat, sugar, all these things is to stop and start learning yogasanas or exercises or morning walk will definitely help a person to come out or regularize sugar level in the body. Ayurveda, in Ayurveda, there are very effective treatments to come out of the diabetes or manage the diabetes, depending on how the chronicity of the diabetes, as well as the reason or causative factor for this disease. So either temporarily you may need to take medicines, change your lifestyle, food, or else you may need some medicines to manage your sugar level in the body. Again, the combination of Ayurveda medicines and yogasanas will definitely help to come out of the stress level, change the lifestyle, change the food, as well as control your diabetic level in the body. Please, you have any questions, you can ask here. I will try to share whatever knowledge we have, whatever the possible way we can help you. If you have any question, you can write here, and we'll discuss more diseases or more things related to health and other things, as well as we'll talk about almost all diseases, disorders, diseases in detail. Even we'll talk about preventions also. Keep tuned in my channel with me. See you soon again with little more or some more topics. Anything is there, please feel to write here. Thank you. See you soon.